So in this video we are going to talk about the various bacterial stains. So the bacterial stains are the technique to demonstrate the various types of the bacteria. So we'll talk about the various stains like Gram stain, Giemsa stain, PAS stain, that is periodic acid stain, ZN stain, that is the Gill Nielsen stain, India ink stain, silver stain, fluorescent antibody stain, and Albert stain. Now let us first talk about the Gram stain. The Gram stain is the first line of laboratory test in the bacterial identification. So after the Gram stain, the various bacteria which appear violet are the gram positive bacteria, whereas the various bacteria that appear red or pink are the gram negative bacteria. So you have to know that the bacteria with thick peptidoglycan layer retain the crystal violet dye, that is the gram positive bacteria, and the bacteria with the thin peptidoglycan layer turn red or pink with the counter stain, that is the gram negative bacteria. I want to describe the brief about the gram stain is that we do the primary stain by the crystal violet, which gives the violet color, and we do the counter stain by the carbolfucin or safranin. So the bacteria which retains the primary dye, which is the crystal violet, is the gram positive bacteria, and the bacteria which retains the counter stain and appears the pink or red, that are gram negative bacteria. So the various examples of the gram negative bacteria are Staphylococcus and Streptococcus. So Staphylococcus and the Streptococcus are the examples of the gram positive bacteria. So you can see in this figure also those type of bacteria appears violet in color. And the gram negative examples of the gram negative bacteria are the Neisseria, Vibrio cholerae, and Helicobacter pylori. So this you can see in this picture is that the gram negative bacteria appears pink. Those may be the Neisseria, Vibrio cholerae, and Helicobacter pylori. Now let us talk about the Giemsa stain. So the Giemsa stain, you can see it is used to demonstrate the rickettsia, chlamydia, and trypanosomes and plasmodium. So you can see in this picture is that these are the various trypanosome that has been stained by the Giemsa stain. So this when stained by the Giemsa stain, trypanosomes appears like this. Now let us talk about the PAS stain. The PAS stain is the periodic acid strip stain. So it stains the glycogen and mucopolysaccharide. They are used to diagnose the Whipple disease. You know the Trophirema whippeli. So Trophirema whippeli can be demonstrated by the PAS stains. So you can see that Trophirema whippeli, you can see in this figure is also that they stain like this by the periodic acid strip stain. So whenever you see this type of the stain in any microbacterial microscope, you should suspect that Trophirema whippeli. So now let us talk about the ZN stain, that is the Gill Nielsen stain. So there is the use of the carbolfucin, which will demonstrate the various acid fast bacteria. So you can see in this figure also there is the demonstration of the mycobacteria. So this is how the microbacteria will appear after the ZN stain. They resist the decolorization by the acid. So they are known as the acid fast bacteria. This is the examples of acid fast bacteria, that is mycobacteria. And Nocardia species of the bacteria can also be demonstrated by the ZN stain. So the ZN stain stains the mycolic acid in the cell wall, and some of the protozoal oocysts like Cryptosporidium oocyst can also be demonstrated by the Gill Nielsen stain. Now let us talk about the India ink stain. The India ink stain demonstrate the various bacterial capsule. It doesn't differentiate between the gram negative or gram positive bacteria, but helps to demonstrate the capsule of the bacteria like the Cryptococcus neoformans. And the silver stain will demonstrate the various fungi like the Coccidioides, Pneumocystis cerebeaceae. You can see in this picture it's also that how the Coccidioides are demonstrated by the silver stain. and the various Legionella species and Helicobacter pylori can also be demonstrated by the silver stain. Now there is fluorescent antibody stain which will identify various bacteria, viruses, Pneumocystis jirovecii, Giardiasis species and the Cryptosporidium. The one of the examples of the fluorescent antibody stain is to demonstrate the syphilis. Fluorescent toponymal antibody we say it. Now let us talk about the Albert stain. The Albert stain will demonstrate the Corynebacterium diphtheria. The Corynebacterium diphtheria take up the bluish purple color. Hence they are called the metachromatic granule. So they have the metachromatic granule at the poles of the bacteria, which are also called the polar bodies, volutin bodies or Bevis Ernst granules. So you have to know this about the Albert stain. So we talked about the various bacterial stain. We talk about the gram stain, which will demonstrate between the gram positive and the gram negative bacteria. We talked about the Giemsa stains. It will demonstrate the tough bacteria like Rickettsia and Chlamydia and trypanosomes and various other parasites like the Plasmodium. We also talk about the periodic acid strip stain. We talk about the Zn stain that will demonstrate the acid fast bacteria. Acid fast bacteria, one of the important examples of the acid fast bacteria is Gill-Nielsen stain. We talk about the India stain which will demonstrate the capsule of the bacteria, though it will not demonstrate between gram positive and gram negative or any other acid fast bacteria. We talk about the silver stain which will demonstrate various fungi. Also it demonstrates the Legionella and Helicobacter pylori. We talk about also the fluorescent antibody stain which will demonstrate identify the bacteria, viruses and any other parasites like the Zydra, and it is also used in the syphilis. You have obviously heard about the fluorescent toponymal antibodies. And we talk about the Albert stain which will specifically demonstrate the Corynebacterium diphtheria. So the granules with that are demonstrated of the Corynebacterium diphtheria by the Albert stain is also known as the polar body, volutin bodies or Bevis Ernst granules. So I hope you understood this topic on the various bacterial stain. Thank you.